Have you heard about the latest COVID-19 strain JN1? It's causing quite a stir in the medical community. In the world of infectious diseases, there are few things as concerning as the emergence of a new viral strain. In the space of a few short months, the SARS-CoV-2 virus, which causes the disease we know as COVID-19, has produced numerous variants. One of these is JN1. The JN1 strain is the newest variant to cause widespread concern. It has been detected in multiple countries around the globe, and its prevalence is rising rapidly. This has led to a flurry of activity among epidemiologists, virologists, and public health officials. This new strain JN1 is a variant of the COVID-19 virus. A variation in the world of virology is a slightly different version of the same virus. It's not a completely new disease, but it has some differences in its genetic makeup that make it stand out from the rest. The discovery of JN1 has been met with a mix of fascination and concern in the scientific community. Its unique genetic mutation has piqued the interest of researchers, are scrambling to understand its implications. What makes this strain different? How does it behave compared to other variants? These are the questions that are driving current research efforts. The symptoms of JN1 are another area of intense interest. While the core symptoms of COVID-19 remain the same, fever, cough, and difficulty breathing, there are subtle differences with JN1. Researchers have noted a higher incidence of certain symptoms, such as loss of taste or smell. This information could be vital in helping doctors identify cases of JN1. The severity of JN1 is also a significant concern. Early reports suggest that this variant may cause more severe disease than previous strains. However, this is still an area of active research. Scientists are working tirelessly to confirm these findings and to understand why JN1 might be more dangerous. In the world of public health, understanding a new viral strain is a race against time. The more we know about JN1, the better equipped we are to fight it. This means studying its genetic makeup, symptoms, and severity, as well as how it spreads and how it responds to existing treatments and vaccines. This is no small task. It requires the combined efforts of researchers, clinicians, and public health officials from around the world. It involves collecting data, running experiments, and analyzing results. It requires communication, collaboration, and, above all, time. As we learn more about JN1, we can adapt our strategies for diagnosis, treatment, and prevention. For example, if we find that existing COVID-19 tests don't detect JN1, we may need to develop new tests. If we discover that current treatments aren't as effective against this variant, we may need to adjust our treatment protocols. And if we find that our vaccines don't provide sufficient protection against JN1, we may need to update our vaccines. In the face of a new viral strain like JN1, information is our most powerful weapon. Every new piece of data brings us one step closer to understanding this variant and how to fight it. It's a daunting challenge, but one that the global scientific community is more than equipped to tackle. Understanding these characteristics is not just a matter of scientific interest, but a crucial step for effective diagnosis, treatment, and prevention. As we continue to grapple with this ongoing pandemic, let us remain vigilant and informed. The fight against COVID-19 and its new variant JN1 continues. JN1, like its predecessors, is transmitted from person to person. The specifics of its transmission patterns are still under investigation, but knowing these patterns will help individuals and communities implement targeted preventive measures. The emergence of JN1 is not just a health issue, it has far-reaching implications on a global scale. The potential impact of JN1 on global health systems and economies can't be overstated. Policymakers and healthcare professionals need this information to prepare and adapt. The urgency of adapting preventive measures underlines the importance of individual and community action in curbing the spread of JN1. Misinformation can be as dangerous as the virus itself. That's why it's vital to dispel misconceptions surrounding JN1. Accurate information combats misinformation and panic, enabling informed decision-making by individuals and communities. Equipping you with knowledge about JN1 doesn't just empower you to better protect yourself. It also allows you to contribute to eliminating its spread. In review, we've discussed the characteristics of the JN1 strain, its transmission patterns, and the potential global impact. We've also touched on the importance of accurate information and the power of knowledge. Remember, we're all in this together. Every step we take towards understanding and preventing the spread of JN1 brings us closer to a safer world. Stay informed, stay safe, and thank you for joining us in this conversation.